Hi everybody, my name is Andrea Viney and today I wanted to discuss Zen nurses. The overall purpose of my speech is to simply identify the stressors of nurses in their everyday work life and how those stressors can significantly affect the health communication with their patients. And I also wanted to identify a new holistic meditation approach known as the mindfulness-based stress reduction technique, or the MBSR for short. As defined by Athena DePrue, who is the author of our communications textbook entitled Communicating About Health, stress is defined as a physical and psychological response to an intense stimuli. Now, although this speech will be about nurses, each and every one of us has experienced some level of stress, whether it be large or short. We have experienced it. Maybe not in the same context as a doctor or a nurse, but we've experienced. Seeing as the healthcare career is the most emotionally demanding career that you can choose, it is also one of the most stressful. Our book identifies that 300 to 400 physicians commit suicide a year due to stress. I personally wanted to identify the stresses of nurses because they are the first people that we have an interaction with when going to the hospital, doctor's office, or clinic. First, I wanted to discuss the actual stressors that nurses go through every day. One stress that nurses go through is that they often have a simple lack of respect from their superiors. They often are questioned or not followed through with the specific diagnosis they may have for a patient, or if they disagree with a doctor's diagnosis, they often don't say anything. This leads to a decrease in the amount of autonomy and respect that nurses feel for themselves. Another big stressor that nurses will go through is physical and emotional disrespect from doctors that they work with. They will be mostly sexual harassment type things, so talking in a negative way, not feeling comfortable around the person that you work with, or being touched or groped in a unwanted manner. Another thing that nurses really go through, and doctors as well, is long work hours. So that means they're often away from family, friends, and have a lack of a social life in general. So that means they're around a lot of heartache, pain, sickness, and disease 24/7 and have no outlet to release that stress. Now I want to discuss the actual side effects of that stress, one of them being a lack of focus. Nurses often write the wrong information on patient charts, or they won't put in the correct amount of information. So doctors often aren't able to treat their patients correctly. Another big one is a depersonalization of patients, which is just a tendency to treat people or patients like they don't matter. It's very impersonal, unfeeling, a lack of empathization, period. And lastly, burnout is a major thing of nurses and doctors. Nurses will have a type of emotional exhaustion, so they'll be drained and fed up with everything, so they really have no way to empathize or feel towards their patients. Now it's time to talk about how to reduce those side effects of that stress. The article that I chose to use is written by Sarah A. Smith. It's entitled Mindfulness-Based Stress Reduction, an Intervention to Enhance the Effectiveness of Nurses Coping with Work-Related Stress. This article explains how mindfulness-based stress reduction technique, an 8-week program that infuses yoga and mental therapy to improve the overall health mentally and physically of an individual. Nurses participated in an either 8-week or 4-week program, and after those programs, they found that it was a significant reduction of anxiety, stress, burnout was reduced significantly, which is also a really big thing that I've already discussed. So this MBSR technique is very simple. It doesn't take that much time or effort to do. All you need to do really is have a few minutes to yourself where you can focus your mind and simply take part in all of the things that usually would stress you out. You let away, you acknowledge them, but you don't let them affect you physically. I wanted to show you guys an example of a type of chair yoga MBSR meditation where nurses or even you guys can participate in just a few seconds of the video. Let me get to it for you guys. As you can see, the biggest thing with this type of meditation and yoga is breathing. You're always focusing on your breathing, but acknowledging every single thought that comes to your mind, just not letting it consume you overall. Anyone of any age, culture, or experience can participate in the MBSR technique. It only takes a few minutes out of your day, and it really does help. Now I want to know your opinions of this technique. Would you use it, or would you feel like it's a nice investment for hospitals or clinics to provide this type of education or treatment program for nurses or doctors before they go into their field during training? Despite the numerous amounts of stress that nurses go through on a daily basis, they can always fix it with the MBSR technique if they choose to go that route. So the next time you or anyone you know is going through some type of stress, take a moment, sit back, relax, and start breathing and enjoy those moments in life. Thank you.